Well, good afternoon, everybody. This is Stephanie Hall, and I am with the ESRD NCC National Coordinating Center. Thank you so much for joining us today for the End-Stage Renal Disease National Coordinating Center Professional Education Webinar. As you know, these events are being held in partnership with the Centers for Medicare and Medicaid Services. The series of events feature guest speakers from around the country sharing how they or their organizations they are with are coping with COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted to the NCC COVID webpage within 3 business days. Next slide. So just a little bit about the agenda today. Our speaker today is Dr. Silvers. He's the Medical Director, Pharmacy and Infection Control with Sutter Health. He's going to be talking to us today about influenza prevention, COVID, and renal disease. We want to hear from all of you today. If you have questions throughout this presentation for Dr. Silvers, please submit them either through the Q&A or for the chat. And at the end of the presentation, we should have time to get through as many questions as possible. Next slide. So what's this call about? Well, these are bi-monthly calls where we hear from stakeholders and peers in the ESRD community who are adopting to the COVID-19. Our speakers will share examples and tips to provide real-world strategies for facilities to use to deal with the COVID. Next slide. And I'm going to introduce our speaker. Actually, we're going to do the polling questions first. So we're going to do some polling questions for the audience, and if Matt can assist me, we're going to start off with 3 questions for everybody. And Matt, can you put those polling questions up before we get into our presentation?
Just give me one moment, Stephanie. I am trying to get to that panel as we speak. I apologize for the delay. All right, give me 1 second. For some reason, the polling hit itself, but we are going to get it going here. Thank you, everyone, for being patient. All right, we'll have the first one up here, and I'll open it for you, Stephanie.
Perfect. Hope everybody can see that over there. Our first polling question asks about how many people with ESRD die unnecessarily each year due to influenza-like illness. Just pick one answer, and we'll give everybody a little bit of a time. Matt, when you see that, we're getting a good percent of people answering it, we'll move on to the second one.
All right, will do. And, we'll close this one in about 5 seconds. It does, WebEx is going to take a little bit to tally the results here. So we'll go ahead and close this. And Stephanie, WebEx is going to need about 20 seconds to wrap this up. But I can share with you that there was one response that led the others. And we do not want to display these results now, or do we?
You can display the results. We will reveal the answers at the end of the presentation.
Sure thing. The results should be displayed, and we can see that 1,000 was the most popular answer.
Okay, great. Okay, so let's go on to our polling question number 2.
All right. That is now open.
Right. So the next one is the nasal spray vaccine is a recommended option for persons with underlying medical disease, such as chronic kidney disease. Is that true or is that false? Again, we'll give everybody, this shouldn't take too long. So Matt, when you start to see those answers come in,
I sure will. We'll keep this open for a few more seconds, and then, again, we'll close it down. It does look like the number of in progress is dropping, so let's go ahead. If you're in progress already, you should be able to complete this, but we'll have WebEx start to tally up our results as well. And Stephanie, just in a moment, you'll see as well that this one had a clear leader in terms of the number of responses that we got. I'll share them with you here in about 4 seconds. And you should see them on your screen now.
Okay. All righty. Well, then we'll move on to our third and last polling question.
All right. And that one is now open as well.
And the last polling question is, patients with ESRD should get the flu vaccine unless they are pregnant. Is that a true or false statement?
All right, and I do see a bunch of results coming in. We've got over 120 that have completed this, so we'll go ahead and start wrapping this one up as well. Again, if you're in progress at this point, you should be able to complete this, and we'll share this again in a moment, Stephanie. This one's split about 60-40, though, so we'll share that here in just a moment. You'll see the results. And we'll go ahead and get those shared for you now. You should see them on your screen.
Okay. All right. Well, very good. Well, we're going to reveal the answers at the end of the presentation, but thank you, everybody, for participating in our polling this afternoon. So, Matt, I think we can go on to our next slide, and I will introduce our speaker. So our speaker today is Dr. Jeffrey Silvers. He is the Medical Director of Infection Control and Pharmacy for Sutter Health, where he serves as physician lead and expert on COVID-19 for the healthcare system. In his role, he works closely with the California Department of Public Health, where he serves on several advisory committees. He spent more than 35 years caring for patients with complex infectious diseases. He is on the board of directors for the Infectious Disease Association of California, the Advisory Council for the California Immunization Coalition, and has spoken nationally on immunization. So I'm going to turn over the call now to Dr. Silvers.
And HDAC for inviting me to provide a presentation. So if we get the next slide here. So what about the great pandemic of the last century? Why does everybody talk about 1918? And so, you know, we always talk about this great flu epidemic, and the question is, how much do people know about it? The next slide shows something that was written by somebody who was there. And you kind of have to remember this. It's very stark in its description. So pine caskets were stacked in the living room. The city had slowed to a near halt. Schools were closed. Church services were banned. The government limited its hours of operation. People were dying. Some who took ill in the morning were dead by night. Mass graves were dug by steam shovel and bodies buried without coffins in many places. I mean, it's very scary when you think about something like that, and that's why we talk about this so much. Can I have the next slide, please? This is a picture in a collection from Oakland showing what it was like. They just set up hospital rooms wherever they could because they didn't have enough rooms and beds. And you notice they were spaced apart, though. Next slide. So let's fast forward, because we're obviously in 2020, and we're talking about a different virus, and we've had a lot of advances in medical care and technology since then. So let's talk about the difference between COVID and flu. Next slide, please. Okay, and the slide after that. Okay, so influenza, the flu, and COVID. So first of all, the flu is a frequently used short term for the word influenza, but people confuse it. Some people talk about the stomach flu. The stomach flu is actually not influenza. That's a norovirus. And so when people talk about the stomach flu, they're not talking about our real flu. But in this case, we're going to be talking about flu as a shortened version of influenza. Influenza, of course, is a virus that predominantly causes contagious seasonal respiratory illnesses, usually about 12 weeks per year, and it results obviously in increased time off work and excess deaths, increased hospitalizations, increase in people missing things from school, and obviously has a significant impact in people with underlying renal disease. COVID is obviously a disease caused by a different virus. It's a coronavirus, which we called SARS coronavirus 2. At this point, we've proven is not seasonal, but it has the same end results in terms of affecting our lifestyle, affecting our people being able to work, people at home, and hospitalizations and deaths. Next slide, please. So what about the incubation period and contagion? Well, the incubation period of influenza is only 1 to 4 days, but the incubation period of COVID is much longer. It's up to 14 days. The influenza, of course, is seasonal. Outbreaks vary in terms of severity almost every year, usually in the winter. For about 12 weeks long, we have an influenza epidemic in a certain area, and then it migrates to somewhere else. There's historically, it's explosive onset, acute onset of cough, fatigue, sometimes shortness of breath, fevers, headaches, just you feel like you're going to die. You wish you could just get over it. You feel like you got hit by a Mack truck. You feel like got hit with a ton of bricks. Those are kind of classic descriptions. But what we've learned through the years is that's not the way everybody gets influenza, but that's how it's been talked about for years. And most complications are respiratory or secondary bacterial infections. And much of the mortality in 1918 was from secondary bacterial infections. They didn't have any antibiotics in those days. Okay. COVID, on the other hand, has a very high incidence of asymptomatic to mild disease. Now, flu is probably actually close to 40% now, but COVID is about 50%. And COVID can progress to life-threatening disease. And it just shows a wider diversity in presentation that you see with the seasonal influenza. And again, it has complications that are respiratory, but rather than secondary bacterial infections as the main problem, it has involvement in multiple organs with thrombosis and clotting as a common complication. So now let's look at statistics on the next slide. So the 1918 influenza was estimated to kill about 500 million people, which was a third of the world population at that time. It was estimated to have infected 500 million people, a third of the world. It was estimated to have killed 40 to 60 million people. And that was, it turned out to be about the 6-month period of time. In comparison, it took about 25 years to kill that number of people with HIV. So the 1918 influenza was just a dramatic, catastrophic event. COVID, as of November 2nd, so this is a little over a week ago, globally there were over 46.5 million cases. Global deaths were 1.2 million. Compared to 40 to 60 million. So they're very different. We've learned so much about COVID. We have much better hospital resources. We have antibiotics if they do get secondary infections. We have tests to determine if they have a secondary infection. We even have some treatments for COVID. So a lot of progress has been made. So there's big differences between 1918 and 2020. So now let's have the next slide and talk a little about influenza, COVID. So similarities, differences. So there's 3 or 4 different strains of flu that could circulate and cause disease during one season. For example, last year we had 2 different strains of A. One was an H1N1 and the second was an H3N2. And we had 2 different strains of B. So we had 4 strains circulating last year. The year before we pretty much had 3 strains. But 3 or 4 can circulate, cause disease during one season. They can present similarly. Because you can have multiple strains circulating time, you can actually get influenza more than once during a season. We do have a vaccine to prevent influenza. We will be getting a vaccine to prevent COVID. We do not have one yet, although obviously if you heard the news yesterday, the prognosis for getting a vaccine soon has elevated a lot with the Pfizer vaccine, and then we'll probably have at least some initial doses before the end of this year. A person can be infected with both COVID and influenza at the same time. Not common, but definitely there. And if you are infected with both, the risk of dying or being hospitalized, ending up on a ventilator is much higher than if you get one or the other. We do know that social distancing, masking, and hand hygiene can reduce the risk of getting either of those infections. So those are critically important measures that everyone should follow. Next slide, please. So the twindemic. What is a twindemic? Well, that's when we have two epidemics at the same time. So we have the COVID pandemic, and the second great fear is that we're going to have influenza epidemic show up at the same time as we have COVID circulating, and that we're going to have a lot of people develop co-infections. And the morbidity and mortality of people with co-infections will be significantly higher than if you just have one of them. Next slide, please. So how do you manage your personal risk? We have the next slide, please. Okay, so we're going to talk about people with kidney disease, chronic kidney disease, because that's what this is about. And people with chronic kidney disease are at an increased risk of severe illness from influenza. And that includes all categories, really chronic kidney disease at any stage, dialysis patients, therefore CKD5, after renal transplants. The chronic kidney disease weakens the immune response to infections, and so therefore if you get exposed to influenza and you've not been vaccinated and you get disease, your chance of ending up in the hospital is increased and your chance of dying is higher. And also people with chronic kidney disease, as you know, frequently have other coexisting complicating comorbidities. Diabetes, heart disease, pulmonary disease are very common in people with CKD. About 1,000 people with end-stage renal disease die unnecessarily each year due to influenza-like illness. If I go to the next slide, please. This is based on a study that was reported in the Journal of the American Society of Nephrology in 2019. And they looked at several different seasons of influenza, and they looked at the number of people that died during that 12-week cycle when influenza was increased. And if you compared it to each, quarter to quarter to quarter through the year, it was almost like a sine wave, and where the incidence of death due to influenza-like illnesses in people with end-stage renal disease would dramatically increase at the latter part of the year around November and last through March, and then it would go down again. And it did that each year. And when they looked at the numbers, actually the number of people that died with end-stage renal disease between 2000 and 2014 was about 1,000 per year. If you looked at the number of people who had end-stage renal disease who died just from all causes during that 14-year period, it was up from 390,000 to 678,000. But that's really probably related to the number of people with end-stage renal disease. Next slide, please. So what can you do to reduce your results if you have ESRD? Well, first of all, you should get a vaccine. Number two is you need to make sure you get the right vaccine. Number three is you should get the vaccine that's related to your age group, not just your renal disease. And then if you have a respiratory infection and you're being dialyzed, you need to isolate that person from someone else in the unit so that they don't get exposed. And then we should practice social distancing when we can. We should have people wear masks. And, of course, hand hygiene. You can never replace the importance of hand hygiene. Next slide, please. So let's talk about some of the myths versus facts of influenza vaccine, because there's always a lot of questions. There's a lot of information people want. They go to the internet, and sometimes you read things that are true, and sometimes you read things that aren't true. Sometimes we talk about things that happened many years ago, and people think it's still a risk today. So let's go on to the next slide, please. So myth number one, my flu shot gave me the flu. Probably one of the most common myths that we hear. So the flu vaccine contains only part of the virus, which they call the hemagglutinin. That's not a whole virus. That part of the virus cannot replicate itself. There's nothing living there. So when you get the flu vaccine, you don't get living virus, you can't get the true flu. Now that doesn't mean you can't feel sick. It doesn't mean that you aren't going to have a little fever or sore arm, some aching, or even a headache. These usually go away within 1 to 2 days. How often does that occur after a flu vaccine? Some parts of those, be just a sore arm even, is up to about 10%. Fevers is about 2 to 3%. So it's not a high number, but it's not insignificant. The other thing about getting the flu vaccine takes about 2 weeks to actually work. So if you get exposed to the flu and you've had the flu vaccine and it's only been a week, you're not protected from the vaccine adequately, so you could easily actually get the real flu. The other thing that you have to know is the flu vaccine is far from perfect. As I said, we have like 4 different strains that circulate, and some of those strains can mutate during the season. We decide the vaccine for, say, 2020 to 2021 is decided by what's circulating in 2019 to 2020. So we look at last year's virus, as close to the end of the season as we can, and see what is circulating. From there, they then develop a vaccine based on what's circulating then, not necessarily what's going to circulate next year because we don't have a crystal ball to answer that question. And then you have to modify the virus strain so that it grows in chicken eggs, and then you have to then get that. So you are getting a vaccine that's based on last year's virus that's been modified to grow in chicken eggs, and it doesn't predict exactly what's going to be around next season. So vaccines for flu are far from perfect. Next slide. So I never get the flu, so I don't need the vaccine. Well, it is true. I mentioned up to about 40% of people who develop influenza may be asymptomatic. So you may have had the flu, and you may be lucky enough not to get disease. But obviously, people with CKD are much more likely to be symptomatic than asymptomatic. You also, even if you didn't get disease, presuming that you're a healthcare worker and you provide care to people and you've been healthy, well, you may give it to a patient if you are asymptomatic because you didn't get a vaccine. You also may give it to a spouse, a child, a friend, a grandparent, a mother, a father. They may be medically vulnerable, so you may not be feeling anything, but you may make someone very ill who you love. So you need to protect your loved ones and the larger community. It isn't just the flu vaccine, I don't need it. It's really, what does it mean for everybody else that I'm around? Next slide. So getting the flu is not a big deal. Well, actually, for the 40% who are asymptomatic, you're absolutely right. But it really can be a big deal. Is it going to be like 1918? Well, not at this time, happily, and unlikely to ever be like 1918 again because we are able to develop a vaccine. We are able to identify the virus quickly to do genomic sequencing and even come up with a modified vaccine if we need to. But it is a big deal for people who are high risk with chronic medical conditions, especially chronic kidney disease, the elderly. It leads to hospitalizations and deaths. Like I said, over 1,000 people die per year with end-stage renal disease secondary to flu or flu-like illness beyond the number that normally die every year with that disease. Pregnant people and people younger than 6 months are also very high risk. And pregnancy is an important consideration. It's all stages of pregnancy are at risk. Having seen patients who did not get the flu vaccine, who got the flu and then lost their baby in the second or third trimester because of the baby died because the mother got flu is tragic. It's very sad. The other thing, when you talk about pregnancy and risk of complications from flu, they are at risk for 2 weeks after they deliver also. So it's not just during pregnancy, but actually 2 weeks after that mother is at higher risk for having severe complications from the flu. Next slide, please. So I'm young. I don't need to get vaccinated for the flu. Well, again, everyone is susceptible to influenza. So young, less than 6 months, are very high risk. But everybody after that is still at risk. You get at risk of getting the disease and getting very sick, missing work, missing school, giving disease to other people. And yes, even though young adults who are healthy and don't have underlying renal disease, for example, or diabetes or anything else, ultimately do fine. I've seen them in the hospital. I've seen them where they almost die. I've seen them actually die. It's really just tragic. Now, the ones who are young that I've seen die are the ones who stayed home for so long because they were convinced they'd get over it, and they lived alone. And then when they got so sick, the family had checked on them or friends hadn't checked on them and they finally found them, it was just too late. Those are just tragic situations we'd like to avoid. And again, even those who don't get severe disease frequently have to miss school or work, and residual fatigue is not uncommon. So there's a lot of reasons why you should get the flu vaccine in spite of being young. Next slide. Okay, so I'm pregnant and I can't get the flu vaccine. Well, not true. And all pregnant women should get vaccinations because you're at significantly higher risk for serious complications from the flu. I've seen a number of women with very severe influenza who end up in the ICU. I mentioned already they lose. I've seen them. I've seen them where, fortunately, not a lot, but I've seen them where they've lost their babies. And then, of course, premature births can happen because they go into labor with the influenza and they get influenza disease. The vaccine is safe during pregnancy. For a lot of years we didn't know, and it wasn't. And so, the general rule is for a pregnant woman, don't give her a medicine or a vaccine or anything that she doesn't need. So it took a lot of years before they finally accumulated enough evidence from women who got vaccinated for one reason or another that they finally showed, they do fine. In fact, they do better because they don't get influenza. And I mentioned flu can be harmful for a developing baby, and I've seen that. Getting the flu shot while you're pregnant even protects the baby from the flu for months after the baby's born. That's true because the last trimester of pregnancy, the antibodies that you developed from your flu vaccine cross over through the placenta to the baby. So when the baby's born, the baby has your antibodies and has some protection. It's very good because babies younger than 6 months cannot get the flu vaccine. And so we don't want newborns, we don't want anybody to get the flu, but newborns or very young babies that get the flu could be very sick and they end up in the hospital, very difficult situations, and unfortunately sometimes they die. Next slide. So I got vaccinated for the flu last year, so I don't need it again this year. Okay, so I mentioned there's 4 different strains of influenza that are frequently circulating, sometimes only 3. And those strains can mutate, and it takes a minimal change by the virus to be able to avert the efficacy of the vaccine, to sidetrack it. And that, the goal of these viruses are to propagate. So in order to propagate, they need to make people sick. They don't need to kill people. That's not the goal. The goal is, is make someone sick enough that they spread to more people. They can mutate. They can sidestep the vaccine by changing. So if you depend on your immunity from the previous year, it's unlikely to work. We change the vaccine every year to keep up with those changes, as I talked about. And again, I mentioned you can get the flu more than once in a season from different strains. Next slide. So what about flu shot pain? So here's some tips to avoid it. Take deep breaths, clear your mind, relax. A lot of people look away, but relax your arm, look away, and then after you get the shot, move your arm around. And if you really need something, take a little acetaminophen, Tylenol, or an ibuprofen, brand name. One of them is Advil, but people usually go for generics, right? And it usually goes away. Frequently, if I get a little sore arm, all I do is move my arm around, and it takes me almost no time, and I don't even remember that I had it. It works for a lot of people, and yeah, some people do get very big swollen arms. It does happen. But the fortunate news is that doesn't happen very often. Next slide. So Voltaire he had some wonderful sayings. And one of my favorite is that perfect is the enemy of good. If you want to try and get perfection, you wait for perfection, you're going to miss a lot of opportunities in life. And not getting your flu vaccine because it doesn't always work is putting yourself and your loved ones at risk of getting a life-threatening disease. So even if the protection is incomplete, is partial, okay, you still may not have a severe disease, you still may not spread to other people, and yes, that will save lives. So before we go to the next slide, I also want to mention one other fact versus fiction. There's a talk about, Guillain-Barré syndrome, because I know a lot of medical professionals are supposed to be on this call, and association with the flu vaccine. And Guillain-Barré syndrome is a paralysis syndrome, most commonly associated with other infectious diseases, not vaccines. It's most commonly associated like a Campylobacter, the GI infection. But it's been associated with the flu vaccine right and wrong for many years. In the mid-1970s, there was a strain of the flu vaccine, the swine flu vaccine, back in the mid-70s, which is almost 45 years ago, that truly was associated with an increase of Guillain-Barré after that. Subsequently, none of the vaccines have. So what are the chances of getting that paralysis syndrome from the flu vaccine? The chance is 1 in 1 million that someone will develop Guillain-Barré in some time frame after they got a flu vaccine. What is the chance of getting Guillain-Barré without the flu vaccine? 1 in 1 million. They have not shown that your chance of getting Guillain-Barré is increased by the flu vaccine. If it is, it's a minuscule amount, and it's probably very close to zero. So let's go to the next slide for some take-home messages. Okay, so all persons 6 months or older who don't have the few contraindications to it should receive an annual flu vaccine. The real contraindications are people who've had severe reactions to the flu vaccine. Persons with chronic kidney disease are at increased risk of having severe illness and possibly dying from flu. And again, we have over 1,000 excess deaths per year. And what do you need to know about the flu vaccine? Well, it reduces your risk of getting the flu, reduces the risk of ending up in the hospital, on a ventilator, or in the ICU if you get the flu, and lowers your severity of illness if you do get sick. When you get vaccinated, the time is now. Don't miss that opportunity. You do not want to put yourself at risk for that twindemic. You do not want to risk the chance that you could have flu and COVID at the same time. You don't want either of them. And this is the best thing that you can do to prevent the twindemic from hitting you and your patients. Next slide. So through Sutter Health, where I work, we do want to thank everybody who takes care of patients, our heroes, all the healthcare workers at so many different levels. And it's not just taking care of patients directly, it's also the EVS people. It's all the people in the lab. It's all the people in the pharmacy. And thank you so much for helping keep us safe and for protecting us from the coronavirus. Please stay healthy and strong. This is from one of the kids from one of the families that wrote to us. So now we have some time for questions.
Well, thank you, Dr. Silvers. That was very, very good. A lot of good information in there. I think before we go to the questions, Matt, I think, right, we're going to now quiz our participants and see if they may have changed some of their answers to the questions. So we are going to do the same polling questions and see what the results are. So the first one, again, about how many people with ESRD die unnecessarily each year due to the influenza-like illness. So we expect everybody to get that right, since Dr. Silvers shared that. We'll see.
And I'll leave this open for just one or two more, a couple more seconds.
Okay.
It looks like it's wrapping up. All right. We'll go ahead and, while we do have half a dozen or so in progress, we'll go ahead and start to wrap this one up. And again, it'll take WebEx 20 seconds or so to tally these results, but the sneak preview of the results is the answer that is correct has gotten a larger percentage of correct responses this time. So,
and if you don't get that right, we'll have an after-school class and talk about it.
Correct. Okay. So
right,
yeah. Okay.
It should be shared.
Yeah, so you're right. Almost everybody who answered did get that answer question. So the correct answer is 1,000. So that was D, and you're right. I did see a lot of them change their answers from the pre-polling questions. All right, so we'll go on to question number 2. Again,
all right, that is open.
Yep, the nasal spray vaccine is a recommended option for persons with underlying medical disease, such as CKD. Is that true or false? We'll see how that comes out.
All right, same as last time. We'll leave this one open for about 10, 15 more seconds. We have got over 100 responses already, so thank you to everybody who's quickly answering.
I'm not sure I specifically called that out either, and I should have. I will.
It was in your slide, though.
It was.
And while this is wrapping up, it'll be about 10 more seconds. Again, a tremendous amount more on the correct answer. And you should see them now.
Okay, so we still have somebody who's, a few had said true, but it is false, and you're right, it looks like overwhelmingly everybody picked the correct answer on that. Okay, great. So let's look at our last polling question.
Last but not least, here it is.
That's right. Now this one he did spend some time on. So patients with ESRD should get the flu vaccine unless they are pregnant. So
all right, we are approaching, we are well over 100 responses here, so we will leave this one open about 5 seconds or so more. It looks like over 60% of our attendees have participated in this one. We'll go ahead and begin to wrap this one up as well. So as we tally again, not quite as overwhelming as the other 2 questions, but certainly a lead response, about 80-20 it looks like. And we shall share that here in just a moment, Stephanie. A couple more seconds, and here you go. There.
Okay, all right. Well, still, most of them said it was false. So, and as Dr. Silvers emphasized, pregnant women are and should get the flu vaccine. So I think we made some headway, though. I think there was a lot of people that changed their answer, so that's good. And thank you, Matt, for helping. And we will now go into some Q&A. There were some questions that came in, so let me just get to those. Okay. So we'll start here with a question that came in, and it says, what is the difference between level of contagiousness with COVID? Someone who is asymptomatic can remain contagious for up to 10 days after testing positive. How does that compare with the flu?
Well, that's a very good question. The flu's probably about 2 to 3 days if they're asymptomatic. Whereas, again, COVID, if they're asymptomatic, is probably up to about 10 days. We say 10 days. Realistically, it's actually probably 8 days. The thing about when they're asymptomatic is you don't know when they actually first became symptomatic. But we know that people who are symptomatic with COVID, we cannot grow the virus anymore after 8 days. So asymptomatic is probably the same. But again, flu's much shorter. It's only a few days.
Great. Here's another question from Heather. It says, how many strains are there of COVID at this point?
Actually, there's a lot, but we're not sure. There's a lot of genetic variations that are occurring, but they appear to be insignificant. So I don't know whether I'm going to call them strains yet. They just have very minor modifications. They don't seem to have modifications thus far at this time that really affect how severe the disease is. And the vaccine, the modifications are mild enough that it looks like the efficacy of the vaccine will not be affected by them. But I would anticipate that we'll start to have a modification over time that may take hold, and that we might get recurrent and repeat infections, and COVID could become an annual type of thing in terms of new strains. But the ones that are out there right now are just minor changes, pretty much.
Okay, right. Thank you. That's interesting. Yeah. Another question says, Dr. Silvers, is the high-dose flu vaccine recommended for ESRD patients under age 65 since they're all immunocompromised?
So the formal answer is no. So the Advisory Committee of Immunization Practices makes the recommendations, and it's strictly evidence-based. And although there's limited evidence, and it makes sense that the higher dose might be more worthwhile, there's not enough evidence for them to change their recommendation at this time. So the formal recommendation remains minimum of 65 years of age. And there's the high-dose vaccine, and then there's another vaccine by a company called Seqirus, which has an adjuvant in it, where that's kind of an extra little stimulant for the immunity. That works the same as the high-dose vaccine. And both of those, so basically there's two different vaccines that are approved for people over the age of 65. And chronic kidney disease is not specifically called out yet.
Okay. We have another question in here. It says, how do you convince the Black patients to trust the vaccine? Many are fearful due to previous history of vaccines in general.
Are you talking about the COVID or the flu vaccine?
Flu vaccine.
Okay. So the flu vaccine's been around for a lot of years. And in terms of mistrust, I totally understand that historically and how people have had mistrust of the healthcare system. And there are racial and ethnic things that have happened that make sense for that. But the flu vaccine is not geared towards the African American population. It's geared towards everyone. There's no preference there. It is so the same white person or Asian person is getting the vaccine is the same one as a Black person. So in that case, I say it really isn't a racial or ethnic type of issue. The other thing is the flu vaccine is not a perfect vaccine, period. I'm very comfortable saying that. It's far from perfect. I wish it was a lot better. There's a lot of work going on to make it better, but it helps. It absolutely helps. So I think being honest is the key point. Don't go tell somebody the vaccine is the best thing since apple pie, but to tell them, here's why you get the vaccine. It lowers if you get disease, because you still may get disease, you're less likely to end up in the hospital. You're less likely to die. And if you're healthy and don't have end-stage renal disease and you're getting it, okay, one is you're less likely to get disease, but two, you're protecting a lot of other people you care about. That's why you get the vaccine.
Perfect. Thank you. If ESRD patients are experiencing flu-like symptoms, how long should they wait to see their doctor about their symptoms?
Well, that's another great question. So it really depends on, so if you're saying flu-like symptoms, meaning that you're having fevers and headaches and just feel awful, you should call your doctor. And it doesn't mean you have to go right in, but should you call your doctor? Yes. And the reason is that we have a medicine for the flu called Tamiflu, close to Tamiflu, and that actually lowers the severity of disease in people who have underlying risk factors, like end-stage renal disease. So if you take that medicine, it's one tablet twice a day for 5 days, you're less likely to end up in the hospital, less likely to die. So, and it's inexpensive and well tolerated overall. So that's something that you need to be looking at. So that'd be a good reason to call your doctor. I think actually there's probably a dosage. I'm sure there's a dosage adjustment for end-stage renal disease where you actually take a lower dose than I just told you, which was the standard dose. And if you're healthy and don't have renal disease, so let's say you're 40 years old, you have hypertension but nothing else, if you get started on this medicine, it's approved for within the first 48 hours, but if you get started in the first 24 hours of illness, it works really well. 24 to 48 hours if you're healthy, maybe not so much. But you also have to understand the reality of it. Other than the first 24 hours of the disease, it doesn't make you feel dramatically better like an antibiotic might for a strep throat or something, but it works. So again, notify your healthcare provider early for possible treatment. Two is you want to let them know, because if you're on dialysis, we need to make sure that your fluid balance is maintained. If you have diabetes, that what to do with your blood sugars and how to adjust your foods so that you stay well. And then again, depending on how sick you are, they may say, you know what, you need to be seen.
Mm-hmm. Great. We have a lot of questions coming in, so we'll see here if we're going to get through some more. It says in the high dose flu vaccine for patients over 65, is the dosage the only difference between the high dose and regular flu vaccination, such as the Fluzone?
Yes.
There you go. That was easy. Okay.
Well, that's sure enough. Hooray for next question.
Yep, that's great. Thank you. Let's see. So should ESRD patients expect side effects from receiving the flu vaccine or the high-dose vaccine?
Same as anybody else. So it's up to about 10% have some little side effects, and 3% may have a little fever. 2 to 3%, so it's about the same. So I got the high dose this year, and I had 0. I don't have end-stage renal disease. My wife got the standard dose, and she normally has. She's got some very swollen arms in the past with the flu vaccine, and she got it this year though because of the concerns about COVID and the twindemic. And she had this year for the first time she had no reactions. So it varies, but I think the side effects for ESRD patients should be about the same.
Okay, all right. Here is one. Have you seen studies in people with type O blood having less symptoms from COVID? If so, are there any studies that you know of that are geared toward people on dialysis, and if they are less likely to get sick with O positive blood?
So the studies are there showing that type A have a higher risk. It's not just O. I think I would probably say B is probably the same as O. So there are studies out there that are suggesting that people who have type A blood have a higher a risk of having more severe disease. I can't give you a study off the top of my head, but it's pretty easy to find it. It's just do type A blood COVID and do a Google search and you'll find it.
Okay, great. Let's see, another question here. What is the average day that COVID-19 symptoms are showing?
So the incubation period is 2 to 14 days, and it's usually around 3 to 5 range, and so that they become symptomatic.
Okay. I have a comment in here just from one of the participants, I think on response to the Tamiflu. It just says, please eat before taking, trust me.
Yeah.
I have never taken it, but I'm going to trust him that he has taken it. So.
Yeah. And then again, we have to dose it properly for people with end-stage renal disease. I just told you the standard dose, but I'm sure it'd be dosed down for renal disease.
Okay, so that's good to know. So let's see. We have a couple more. Let me look over. A couple of them we've answered, and you've talked about them. And I know you said really somebody says, is it too late to get vaccinated after Thanksgiving? Dr. Silvers, you want to?
No, it's not too late, but I mean, the sooner is better, but it's not too late.
Okay, and then can vaccinating someone twice, flu vaccines, provide any added immunity?
So the general answer is no. They've done studies, and they're kind of looking at if you get the flu vaccine early and the flu season starts a little later, and then let's say you get it in end of September, and the flu season doesn't really hit till November, December, and then March, April rolls around and we still have flu circulating, which can happen. The question is, does that season's vaccine still have efficacy, and should you get a second dose? So right now the answer is no for that. And the question of whether you get a second dose would provide efficacy, I have to tell you, the immunity response to influenza vaccine is a very complicated topic, way more than we have time to go into right now. So I think the answer is not recommended at this time, and that's probably as short and succinct as I can keep it.
Okay. Okay. I actually somebody put in the chat box just to thank you. This has been very informative.
Oh, thank you.
Yeah, so looks like maybe a comment and a question. If a patient has been positive for COVID, then tested after 24 hours, came back negative, then after another 24 hours came back negative, will it be considered a false positive? If so, what is the isolation protocol for that patient?
Well, this depends a little bit on what the test was that you were doing. I wish this was a very rare event, but that description is not a very rare event. It does happen, and it depends on the platform that you tested on. So all molecular tests are not equivalent. And if your first test, for example, was not molecular, but was an antigen test, and that was positive, and then you had 2 negative molecular tests 24 hours apart, I would say, yeah, that person doesn't have COVID. Statistically, though, if you have a positive and then 2 consecutive negatives each 24 hours and then 48 hours after the first one, and they're both negative and they're on good molecular platforms for PCR, that's probably, your first test was probably a false positive, yes. Okay.
I think we have, let me see, yeah, we got time, I think, for just maybe 1 or 2 more yet. So being a dialysis patients, how can they safely get a flu vaccine if COVID-19 is spreading in their community?
If you're asymptomatic, so people are being screened for COVID symptoms before they get their flu vaccine. And most places have a process set up where people who have COVID are not being admitted to get vaccinated while they're contagious. So if you want to go to a CVS or a Walgreens to get your flu vaccine, they're supposed to be asking you questions. And if you have any symptoms, then they don't let you come in and get vaccinated. They ask you to leave and go get tested, and if you're positive, to wait until you're clear. And we do the same thing in, like at Sutter Health, where I'm at in California. We do the same thing here. We screen people, and if they're symptomatic, we don't let them get vaccinated at that time. And so we're only allowing people that are asymptomatic. We ask the people providing the vaccines are wearing masks. The patients who come in are expected to wear masks. So again, you've lowered your transmission rate risk. And so you come in, you're wearing a mask. They've done an appropriate social distancing, screening, hand hygiene. You get your vaccine, you go home. All's good.
Okay, great. Another question here. Should you administer the flu vaccine to a patient that is active COVID within the first 5 days?
Yeah. So my answer is we don't do it in outpatients not because the person with COVID can't tolerate the flu vaccine, but because we don't want people with COVID going out and about in any of our healthcare settings, right, if they don't need to be in a hospital. On the second point, though, is for patients that are hospitalized with COVID, yes, we vaccinate them for flu before they get discharged from the hospital. We don't do it when they're critically ill, but as soon as they've turned a corner or if they're not critically ill, we give them their flu vaccine.
Okay. And a question here. If you recovered from COVID, do you really get immunity? And if so, for how long?
So
or do we know?
Well, we have a lot of ideas, but we don't completely know. What we know is that people who are asymptomatic or have mild disease, mild to moderate, where they're not in the hospital, do not get a very good immune response. So they probably don't have very good immunity. We know that the measurable immunity and the T cells drops off where we can't even measure it in a high percentage of those people within 6 months. We know that the people who get the best immune response are the ones who almost die. And so they'll probably have the best protection, and everyone else is probably less. So that's kind of, and we know some secondary, repeat infections do occur. We're just starting to look at those, across the country and the world. So my answer is immunity wanes. If you have mild or asymptomatic disease, it's probably short-lived and probably less than 6 months.
Okay, great.
But we don't know for sure.
Yeah, it is early. I know we still have a lot to learn, but, well, again, we're almost to the top of the hour, so I think we will stop here. A lot of good questions, a lot of good conversation. I thank you so much, Dr. Silvers, for this great presentation. It was really awesome. Again, a reminder to everybody, the slides and the recorded WebEx today will be posted to the NCC website within 3 days, so you can go back and share it or go back and take a look at the slides. Matt, if you can go to the next slide. Just kind of a couple reminders. The NCC has developed some inspirational posters that are on our website. You can visit the link there below the bottom of the slide. We have a couple different ones that they focus on psychological, physical health, emergency preparedness, and COVID-19, which you can access and print if you would like and share within your centers or facilities. Next slide, Matt. And just again, a reminder of the Kidney Hub. It's a mobile-friendly web tool. They were created by our patients, for patients. They have a lot of links to videos and helpful resources like home dialysis, a lot of information on COVID-19, and information about transplant. And new resources are always being added to the Kidney Hub, and you can visit www.thekidneyhub.org today to see and check it out and see what kind of information is out there. Next slide. So our next COVID-19 webinar event, we have the next patient-focused event on November 17th at 4 p.m. Eastern Time. And the next provider or professional-focused event is November 24th at 3 p.m. Eastern Time. Those are already posted to our website. So if you want to visit kidneycovidinfocenter.com to register, you can do that. Those are up there and ready for you to go visit and to register. And next slide. I just want to thank Dr. Silvers again and everybody for attending this webinar today. A lot of good information, more to come, as Dr. Silvers touched on very lightly and probably already heard. There's, the vaccine. There is a lot of movement going on, so I'm sure more to come here in the next couple weeks about that. So things are changing every day. But again, thank you all for attending today. Thank you for participating. We hope to see you on a future webinar, and enjoy the rest of your day, and take care. Thank you.